Wet your hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
The way people can become infected is by droplets that contain the virus. These droplets carry the virus into the air and can enter through the nose, mouth, throat, and lungs of a person who is within 6 feet or 2 meters. The virus infects the lungs, causing the lungs to become inflamed. The alveolar sacs have to be healthy for the body to breathe in oxygen and breathe out carbon dioxide. Infection of the virus causes damage to the cells of the lungs and triggers an inflammatory reaction. Fever may develop. With severe inflammation, inflammatory fluid fills the lungs. This reduces the function of the alveoli, resulting in coughing and difficulty breathing. The oxygen level in the blood may decrease. In some people who become severely ill, other organs may be affected, such as the kidneys or the heart.
The coronavirus, which causes COVID-19, originated in the city of Wuhan, China.
An outbreak of coronavirus infections in the Wuhan province of China in December 2019. Epidemics indicate outbreaks of disease that spread to cover an entire region or the world.
What began in Wuhan has now spread across the globe. COVID-19 is believed to be transmitted primarily through inhalation. Once infected, most people experience mild symptoms, including sore throat, headache, fever, a dry cough, shortness of breath, and fatigue. However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to your blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs. The risk of serious complications increases if a person is elderly or has associated medical conditions. As the lungs fill with fluid, the body's available oxygen decreases, which can lead to organ injury and death. Once infected, a person may show no symptoms but can still infect others.
कोरोना वायरस की वबा जानलेवा नहीं लेकिन खतरनाक है। जन तदाबीर आपके बचाव के लिए जरूरी हैं। दिन में कई बार हाथों को 20 सेकंड साबुन और साफ पानी से धोएं। हाथ मिलाने, गले मिलने, सफर और गैर जरूरी तकरीबात में जाने से गुरेज करें। पेशेवराना और दीगर मेलजोल में कम से कम 6 फीट का फासला रखें। अपनी नाक, कान और आंखों को छूने से परहेज करें। अगर आपको कोई अलामत जाहिर हो, मसलन खांसी और बुखार, तो हेल्पलाइन 1166 पर रुजू करें।
Mechanism of action of coronavirus. How coronavirus attacks the body and what are recommended precautions to take for protecting. The structure of coronavirus has multiple parts. Inside the virus lies the genetic encoding that allows the virus to hijack human cells and turn them into virus factories. A protein encapsulates the genetic material known as the viral envelope. On the surface of the viron are S and HE proteins, the structure of the 2019 novel corona. The large S glycoproteins are used by the virus to gain entry to human cells. They most likely attach to angiotensin-converting enzyme 2 receptors on the cell membrane, allowing the virus entry. The exact mechanism for this is not known. Most likely, as shown here, the human cell ingests the virus in a process known as endocytosis. Once inside the cytoplasm, the endosome opens to reveal the virus's genetic material, a single-stranded RNA. The virus hijacks the cell's machinery to replicate the RNA in N proteins and uses the endoplasmic reticulum to form its M protein outer layer and the all-important S protein. After replication, the virus is carried by the Golgi bodies out of the cell in a process known as exocytosis, so that it can infect other cells. Meanwhile, the stress of viral production on the endoplasmic reticulum eventually leads to apoptosis, or cell death. It should be noted that the mechanism of action for 2019 novel coronavirus is unknown. However, scientists in China have sequenced the genome, while others have used this sequencing to visualize the structure. There is currently no cure or vaccine for the 2019 novel coronavirus, and treatment is only supportive. The virus pathology with an 8-day incubation period, a week of infection, followed by a potential escalation to hospitalization and intensive care,